hops on late, that is totally fine. So thank you guys all for getting on this. This is a great opportunity for us to get Siouxland District Health right here. Tyler, I know I was getting a brief introduction that you were part of the Little Leagues for a while as well, and so it's great to have you on here as well. So thanks for helping out with this, and
yeah,
I'm excited to hear about. And correct me if I'm wrong, you were with Headed, or who are you with?
Yeah. I've been on the board for a long time at Headed. I was the president for 8 years, and I'm still on the board, although I've backed down just a little bit now that my kids are a little bit older and things like that. But I still hang around there a little bit. So
good. Well, great. Well, Kevin's got some points he's going to hit, and then I think obviously if anyone has questions for him at the end, this will be a great opportunity. We're all in the same boat for trying to run people, large groups through our facilities in different ways. So, some of you will have concession stand stuff to talk about. Some of you won't. So, we'll hit the points that we need to hit and get you guys out of here. So, Kevin, thanks for taking the time here, and I'll turn it over to you.
You bet, John. Thank you. Kevin Green, Director here at Siouxland District Health Department. And I and Tyler Brock both are here kind of dealing with this COVID-19. And right now the opportunities around there to expand and kind of open up things for kids to get active again. And I think one of the things that we talked about as a health department is we wanted to provide something like this for your benefit, to answer questions, provide the information, and more importantly is to let you know we are a resource willing to come to answer additional questions that come up. And I think one of the things we looked at just on our own aspect is doing something like this to give you basic information for everything really saves us time in the long run. Otherwise, you probably all have the same similar questions. Related to, I guess, what we're going to talk about is, I just was going to do the introduction. I'm going to turn it over to Tyler, the Deputy Director, and he's going to share some information. Got a few visuals to show, and the document that we actually refer to, we will get that out so that all of you can actually have a hard copy of it too. So I'll turn it over to Tyler then.
Okay. All right. Thanks again, you guys, for coming in tonight and getting a chance to listen to what we have to say. I think, really, to me, there are basically a few foundations of COVID prevention. There's a lot of, the things that we're talking about tonight, in the brief time that we have, it is not going to cover all the issues that you're going to face. I mean, just when we think we've heard it all down here, something new comes up, in a new scenario that we haven't seen and things like that. And it's been this way for several months, and it, hasn't really slowed down. And now it's even changed even more as people are kind of starting to get activities like these going. So it's important for the community. It's important for health. It's been important for a lot of things that our leagues and associations and whatnot get rolling. But you guys know this, and I know John and I know Matt at the city have talked about this. I mean, these kinds of things are going to be under the microscope, though. Publicly, from a public perspective, this is going to be watched by parents, by people who don't think that these kinds of things that should be happening, and all kinds of things. So anyway, and I know you wouldn't be on this if you weren't trying to do your best to make this happen. But I really feel like there's, the foundations of COVID-19 prevention really kind of are based on probably, and these are really in order, frankly, of what I consider them to be, sick people staying home and identifying potentially infectious folks. Number 2 is hand hygiene. Close set, right there is social distancing, and then environmental cleaning. So those are really the foundations that this is built on. Everything else is some version of that. Okay. And so we wanted to talk to you just a bit about identifying cases. And we've got a document here, and at some point, Kevin will allow me to share my screen, and we'll show this to you here, that we'll send it out to some of the bullet points of what we're talking about here tonight. So you don't have to memorize all this. We'll send some of these things out to you here. But it's going to be, one of the main things is understanding the symptoms. Okay. And the biggest thing, you guys, almost everything that we say is going to be for nothing if sick people come to the park, if sick kids come to play ball. I mean, we all know how this is. I think a lot of us are dealing with younger kids, but maybe not. With just you know, we've got to try to, everything that we do on the back end after there's a case and all that gets really complicated. So if we can prevent those things, if we can get them before by kind of weeding out the sick folks, that's really where, you know, anytime someone calls me and they're like, geez, I got a case now at work, what the heck do I do? And I'm like, well, let's kind of really get aggressive at the beginning instead of, you know, going over the top at the end. So we got to make sure we're identifying symptoms, you guys. Symptoms start anywhere, it's a big range, anywhere from 2 to 14 days after being exposed to it. And you guys have heard the whole 14 days now for several months. It can take as long as 14 days for symptoms to start, okay? But you know, we got fever, chills, and fever, chills, cough, shortness of breath. Those were the things that we were looking for right at the very beginning. But after, you know, almost, you know, 2,700 cases here in Woodbury County, we've seen all of the above here. So everything that's on your screen, we've seen that. We've seen anywhere from, you know, super serious infections where people honestly don't recover, and we've had deaths in the county, all the way from people with none of these symptoms or maybe 1 or 2 of these in a very mild sense. But we need to, you know, and again, everything that I'm saying here is predicated on communication between your parents. I mean, I promise you guys, I'm on one of the boards. You can't do it alone. I mean, there's absolutely no way that you can do it without cooperation from everybody involved. But we really need to make it clear that fans, parents, players, coaches, the whole bit, they cannot come if they're sick, okay? If they're not feeling 100%, then they really shouldn't come. I mean, we've all gone to work, right, when we haven't felt well. Every single one of us have probably done it, and this is different now. But this is different where we're at because we have to have a higher level of suspicion for some of these symptoms. So, you know, again, and I know there are things that go around that can, you know, that are not COVID, all right? And we can kind of work through some of those things, but we have to take an aggressive approach at the beginning, hammering it into people not to come if they're sick. I would suggest that we have signs. I would suggest that whatever social media channels you have, you use them and really kind of hammer that. Do not come if you're sick. Have signs out in the park, you know, do not come to these games if you're having these kinds of symptoms. That's just something to where you're doing your best, the best that you can do to make sure that people understand about avoiding those kinds of symptoms. But we've got a couple things here, you know, so if any of your team members or coaches begin to experience symptoms, they should report it right away, and advise them just to stay home. We'll talk a little bit more, you know, we'll talk a little bit more here about, you know, about some of the other things that we can do to, you know, once that happens, okay, you know, once you get to that point. But we've really got to identify those folks and get them staying home, and that kind of a thing. One of the things that is coming up a lot and will come up is the testing for COVID-19. So if you've got somebody that's symptomatic, we're gonna recommend that they be tested. People that are symptomatic should be tested. There's a lot of, you know, people being tested that probably don't need it. They're not having any symptoms and that kind of thing. But we would recommend that if you get a player or a coach that tells you they're symptomatic, recommend that they go get tested, okay? Now, one thing I want to point out, testing is a good tool, but it's not the end-all be-all, okay? So if someone is having symptoms that are similar to COVID-19, they need to be treated like COVID-19, whether they end up testing negative or not. There's some gray area here, okay? And we can kind of help you work through some of those scenarios. There's a million different situations, and some of this you're going to have to just apply some of the principles to that. But in general, you know, things like fever, you know, I've got seasonal allergies. So I'm sneezing, I got runny nose and itchy eyes and things like that. That's kind of a normal thing for me. But a fever's not. You know, a fever, you know, tends to be more infection. And I know there are some folks that can kind of spike some temperatures, you know, on a regular basis. But for the most part, fever is more indicative of infection. And so, you know, we're going to have a little higher level of suspicion for fevers. but recommend if someone has to stay home from a game or practice because they're sick, recommend that they get tested. At a bare minimum, they are out. They are out of practice. They're out of competitions at a bare minimum, until they get those test results. And that, when I say bare minimum, I mean bare minimum, because if they have COVID-like symptoms and they are, relatively common with COVID-19, we're going to recommend that they're out regardless of what those test results come back at, okay? We're going to be really aggressive with keeping sick people out. And trust me, I get it. These kids want to play, the coaches want them to play, parents all want them to play. But again, a lot of this is predicated on the fact that, we're pretty lucky to be playing ball at all at this point. And so we probably just need to, hopefully this is the one year we have to do this. But so anyway, if they report it to you, make sure they stay home, recommend that they get tested. At a bare minimum, they are home. Probably it's going to take 2 or 3 days to get test results back in most cases. At a bare minimum, that's where the starting point is. They're for sure out until they get those results. And make it clear that just because they're negative does not automatically mean they come back. Okay, that needs to be evaluated based on kind of how their symptoms continue and that kind of a thing. So definitely make it clear that just because of negative test doesn't mean you're instantly back in the game. One of the things, as far as reporting cases, notify the coaches, have your coaches or have your league report that to the health department. Now, I'm here to tell you, we're not going to be able to announce to the entire league about people's test results, and you're not going to be able to get a lot of private medical information. And so, that's going to be a line that we'll balance when we get there. You might want to know some of that information, but we will make sure that you know what you need to know. Okay. And there's a difference. There's a difference between getting what you want and getting what you need. And we will for sure make sure that you get the info that you need to protect yourself and your family and that kind of a thing. But have them report that to us. It'll be a good time to talk through the scenario and how that's going to work. The other thing that I would recommend is once you see someone that may have it, start making a list of who those close contacts are. And one of the things that this distancing that we're going to, we'll talk a little bit more about that, but this distancing is so important for lots of reasons. It's important on the front end to prevent, but it's important on the back end too, because if there is a case or if there's a suspected case, and I call you and ask you, okay, so who is this kid next to and I'll go into some of the criteria. Who is this kid a close contact of? And if you tell me I don't know, if you tell me that everybody, well then everybody's out. Then everybody's going on quarantine, and the team is kind of out of commission at the moment. But if you're keeping track and you can say, no, we had really good distancing here, and we had people looking at it, we had parents kind of monitoring it, we feel really good that we had good distancing the whole time. Well, then maybe it's only that one kid that's affected, and it's not the whole team. Okay, so keeping that, so the distance is important, but start developing that list of the closest people to that. When we are talking about close contacts, what we mean by that is, and again, this is a general guideline that the CDC is using, and we're using it too. It is a close contact is considered anybody that is less than 6 feet in distance for more than 15 minutes. Okay, that's the criteria that we're using as a close contact. So if you and me have a brief conversation, so work hard to keep that 6 foot distance. Okay, if that 6 foot distance is maintained, then there's essentially very, very little risk. More than 15 minutes. So this is more than just a couple of kids, you passing by some kid in the dugout or something like that, or you had a brief conversation with a parent and that kind of a thing. So it's less than 6 feet for more than 15 minutes. And that's who we're going to be trying to identify if there's a case on one of our teams in our league. Okay. If if there is a confirmed or a suspected COVID case, they will be out for a minimum of 10 days. The magic, I don't know if you've been paying attention to CDC, you probably don't like I do, but basically what we're doing here at the health department, we release people from isolation when it has been 10 days since their symptoms began. It has been at least 3 days since they were fever-free. They've been fever-free for 3 days. And that means that, no Tylenol and other fever-reducing medications, that kind of thing. And the rest of their symptoms have to be significantly improved, okay? So we kind of call it the magic 10 and 3, because 10 days from symptom onset, 3 days fever-free, and the rest of your symptoms have to be improved. So if you have a case, that's going to be minimum of 10 days. And then it really kind of depends on how their symptoms progress. If they get better right away, 10 days can be 10 days can be the end of it. If, symptoms linger, then it might have to be longer. But that, so again, kind of keeping in mind that 10 and 3 for people being out, that 6-foot distance for more than 15 minutes, that's a magic number. Again, I'm not sure how magic it is, but that's the guidelines that we're using. And so that's what we'd be using in this kind of situation. So it's kind of up to you guys to try to implement things that avoid those less than 6 feet for more than 15-minute situations, because if we can do that, then we can minimize things if something does happen. Let's see. So we do have a few different scenarios up here. And, if a member of your team tests positive, okay, well, the people that are quarantined are going to be in the household. They're going to be teammates that fit that definition of 6 feet for 15 minutes or more. For older kids and, junior high kids and things like that, boyfriends, girlfriends that they've spent time together. And then, if there's other households that, they stayed overnight, things like that, those are the kind of exposures we'd be looking for. One of the things that probably is, maybe it's even more likely than our kids getting this is maybe a household member gets it. And so in that case, if just for instance, if I would get COVID-19, everybody that lives in my house would be quarantined for 14 days, okay? And that's because it can take up to 14 days for people to develop symptoms, and we don't want them out and about when they develop symptoms. And so you could have a player that's out because mom or dad or brother or sister tested positive. That's very possible. And it's 14 days from when that, from the last exposure. That gets a little tricky and sometimes needs a little bit of consultation on our part, to know when that 14 days starts. But that's very possible. So you could have a player that gets it and then they're out. You could have a household member that gets it and your player is out. Probably something that maybe almost all of us have maybe had already so far is a coworker or someone knows a coworker or whatever. And in most cases, those people are not out. I've got a little diagram somewhere, and I could probably pull it. Oh, Kevin's got it. This is my little diagram, you guys. So it's high class, high quality here, but the person in red is the case. Okay, the people in yellow are the close contacts of our person, and the people in the green circle, they're the contacts of the contacts. We care about the person in the red, and we care about the people in the yellow. Nobody's quarantined in the green. Okay, now it can shift if one of the people in the yellow turns into red. Now the people that are close to that person are people that have got to be quarantined, okay? So you can kind of see where the snowball kind of starts once in a while, but this is in general, this is what you'll find. You'll hear about this. You'll hear a parent say, I have a coworker that has it. Can my kid play? In most cases, yes, as long as your kid hasn't been a contact of someone who has it or someone who's suspected of having it. So again, we're more than willing to answer some questions on this, but I think you guys can answer a lot of these questions yourself. Using this simple diagram has really helped a lot of people, including people down here. So let's see here. So then, as far as some of the distancing, the social distancing type things, just a few, just a, number, you gotta have good hand hygiene, you guys. I mean, you've got to be able to provide opportunities for people to wash their hands. Hand to mouth type stuff is one of the number one ways that this virus is passed. And hand hygiene, is as silly as it sounds, is probably the most important thing you can do to prevent yourself from getting COVID-19. And so making sure that you have as much opportunity for hand hygiene. I mean, I know it's not super easy to find hand sanitizer and things like that. So whatever you can get your hands on, get it, make it available to people. Encourage parents to have it. Encourage parents to, to have their kids have their own. I mean, the more the more we've got, the better chances we are. I mean, we've heard, I know some places have talked about sanitizing bats and balls and things like that. And frankly, if we have good hand hygiene, that stuff can be kept to a minimum. Of course, it wouldn't be a bad idea to, be wiping the bats down and things like that at some point, but that's not a replacement for individual hand hygiene. Okay. The social distancing type things, again, you're going to want to minimize the close contact by spreading out. It might be expanding dugouts, and I'm not going to get into specifics here. You guys might have specific questions. We're not going to tell you exactly how to accomplish this, okay? But, spreading people out, whether it be dugouts, whether it be spectators. I don't know, I guess this is a personal thing of mine because I've seen it pop up a lot of times about whether or not you can use bleachers or not. Personally, this is my personal opinion. Depending on the space you have, I think you may need to use the bleachers in order to distance, because personally at Headed, our bleachers take up a big chunk of our side of our base paths. And if we close off our bleachers, all we're really doing is packing everybody else into the non-bleacher areas. So, so what I'd probably recommend that you use them, but just ensure that people are spread out. You can't pack people into them, but at least you can let some folks use them and that kind of a thing. So, but spread out into family groups. Families can sit as close as they want, but non-family groups, you really need to try to encourage that 6-foot distance and try to minimize those close contacts. Obviously, you want to try to limit the huddles and other meetings where people gather in close proximity. I mean, we were kind of joking around today about, if you're going to have a huddle, keep it at a minute or less, and make sure you don't have more than 14 of them, because then you're not hitting your 15 minutes or more. But the bottom line is keep that stuff to a minimum. You guys have probably already seen parents and spectators posting pictures of the high school teams and their with their team meetings, and there's no distancing whatsoever. I mean, that's honestly, in the youth sports programs, and I know from the city perspective, those are the things that are going to get publicity on social media and things like that. Those are going to be the things that give city leaders indigestion and things like that. So we need to try to minimize. Some of this is optics and some of it is genuine prevention. So try to minimize the huddles. Limit the other gatherings that make distancing difficult. What I mean by that is I think about the situations where you have an early game ending and a late game starting, and you have both groups, you have both groups of people still there. So the first game hasn't left yet, and the second game is there, and you got two, all those groups. Try to manufacture some ways to limit those kinds of situations. Maybe there's more time in between games. Maybe there's shorter games. I mean, I know that, that isn't always ideal either, but think about those kinds of things. So try to think about your gathering points. Where do people collect? You guys know your leagues, your fields. Where is distancing hard to get? And those are the things that you need to kind of build in some of those kinds of things. And then, environmental cleaning. You guys, you need to do environmental cleaning, but we need to not. Don't go overboard with this. I mean, make sure that you're wiping things down. Yes, you're gonna probably wipe down your seats and things like that once a night. You need to make sure that your bathrooms, your frequently touched things, are kept clean. But some of this, we're playing a sport, right? So, I mean, some of this is by playing it all, there's, admittedly, there's probably some risk involved just by even doing this at all. But environmental cleaning, just make sure that you're getting enough of that kind of thing done at least once per night, maybe in between games, things like that. You allow a little bit of time. One thing we talked about was, again, maybe ending that first game a little bit earlier so you have time to clean up just a little bit before that second group comes in. I know it's not easy for where I'm a member, but we're going to try to make some of those kinds of things work. Other considerations, concession stands. There's a lot of talk about concession stands, to do it, to not do it. There is nothing that says you cannot do a concession stand. There's nothing food prep related or that kind of thing that says you can't do it. But you have to do it within the principles of the distancing things that we're talking about. I know most of your concession stands are not that big. You can't have them packed with workers. I mean, a lot of you won't be able to have more than one or two people in there, which means you might have to alter what you're doing in your concession stands. You're not going to be able. You really should try to avoid the long lines and the gathering. The 20 people sitting at the window waiting to get their, waiting at the concession stand. So again, if that means you limit the kind of things you do in the concession stand to limit those types of things, that's the kind of thing you need to do. There's nothing that you can't do, but you have to do it within the concepts and within the principles of keeping that distancing. Again, you can't have 5 people running around in a small concession stand working, in close proximity to each other. That's just not gonna work very well. So, a lot of talk about bathrooms. Basically just, you just need to make sure there's a good opportunity for soap and water, good hand hygiene, washing those, maybe, if you can, get them cleaned once, maybe in the middle of the night at a bare minimum, after games are over, you should be making sure and doing that. We've got a lot of frequently asked questions about concession stands and some of the principles that go into that. So I won't go over those each individually with you. But again, I think that just remembering the foundational principles are keeping those sick people out, and fans, coaches, players, the whole bit, keeping the sick people away. Good hand hygiene, making sure that you're providing a lot of opportunities for hand hygiene, building in the social distancing principles to limit those contacts of less than 6 feet for 15 minutes or more, and then some common sense environmental cleaning. And I really feel like that goes a long way. The specifics, I guess, are going to be up to you, and there's a million ways to do this. I don't know that there's too many wrong ways to do it. I know that nobody, and when I say nobody, I mean nobody knows exactly what the right thing to do is. So we're trying to present these principles, and then, there's going to be a million ways. Just like all of our leagues are different, we all do things a little bit different. I'm sure we're going to do this a little bit differently too. But hopefully we can keep, these kinds of things going down, and it is going to, and again, just someone who's got some experience in the leagues like you guys all do, it can't be done by just your board. It's going to involve everybody, coaches, players, fans, parents, the whole bit. And just remember the scrutiny level publicly, that the optics piece of this makes a difference. I don't care what anybody says, it does matter. Cases that get identified in leagues, have a really good chance of closing things down. I mean, literally the whole world shut down because one NBA basketball player got this, right? So, I mean, that's really what, so it wouldn't take much for the city or whatever to kind of shut the leagues down and just say it's not worth it. So, the other thing is making sure you got enough help. I know how these leagues work, and I know help is golden. And so, but you're going to need more help maybe than what you're used to having, on a given night. So, with that, Kevin, I don't know if there's anything that I forgot to mention that you wanted to say. Other than that, I guess we take some time for questions too.
I think the one thing from the health department perspective is this part of this is just our interest and willingness. We want to work with you. As Tyler's mentioned, just some of the reports, we know, and we're already prepping ourselves for the aspect that as soon as you start the activities, there is going to be some upset parent that doesn't think you're doing things right. And so their first inclination will be to call us to report it. We've already happened this with as the governor made proclamations and that sort of stuff. Normally what I think our plan is as far as addressing those is first off to ask the parent, has they visited with either the coach or you? If they haven't brought the concern to you, it's not our role that we're going to walk in to enforce things unless we have a feeling that things are really going dramatically wrong. We want to work with you and give you guidance and kind of answer the questions. Doesn't mean on occasion we may just pick up the phone and say, hey, we've got a few of these reports, when to make you aware we received these. Anything you can do with it, just let us know. But our goal is not to walk in anywhere, and it's not our intent to walk in and shut anything down. We want to work with you to make your league successful. And I think it's important, and it's just, like we said, you're dealing with the public in this aspect, although they are pretty much your teams and your coaches and players, but it's just bound to happen. That's people's general nature. That's going to occur. And so I think one of the things is when this all started, people were perceiving that they would just call us and immediately we'd be out there in our health department car and just shut everything down and take care of it. That's not the way we operate. We want to work with you and to provide as a resource and more like support too. So I think that's something that we need to emphasize. However, on the other hand, with the concession stand, we still do those food inspections. So that's one of the compliance things too. But as far as the COVID and some of your practices, social distancing, that's our goal to work with you, I guess, to make it successful. Any questions from anyone?
Just emphasizing, and again, I think you're going to just have to really kind of hammer it home to the parents and the players and the coaches and whatnot that, being allowed to play is going to be predicated on the fact that we can keep COVID-19 from spreading in our leagues and on our teams. Because it's not gonna work if we start getting cases and things like that. It just won't. You won't have a league. You won't be able to play if that kind of thing is going on. So it's going to take everybody's cooperation to make sure that doesn't happen.
So any questions from anyone?
I have one right away, and this is something Jessica and I were actually talking about earlier. Tyler or Kevin, do either of you have recommendations? Where can we find, what products we're supposed to be using to sanitize, to clean? I know it's really interesting actually hearing you talk about that's actually not as big of a piece, because I was going nuts, banging my head going, oh my God, how am I going to clean these handles and all these frequently touched surfaces? And, we're going to open the pools in a couple weeks, and how are we going to do that? So just maybe for people, where should they be looking for that? Any advice on that? We know these are expensive. It's an expense to get this stuff in.
There's quite a bit of guidance for cleaning products. Now, I will say, Kevin's kind of highlighting there, and we'll send this out to you here, guys. It's not complicated stuff. Basic cleaning products kill this thing just fine. And I know a lot of the measures in place. And again, I don't want to completely dismiss the role that surfaces play in the spread of COVID-19, but it is not the primary driver of how this thing is spread. It is primarily person to person, close proximity, families, close work environments, close indoor environments, environmental type things. Again, I don't want to minimize it, but at the same time, we can go crazy on that side of it, buying stuff and going through all kinds of product and whatnot. Basic cleaning practices are gonna go a long ways, but we will have some specific recommendations in that CDC and the EPA kind of talk about in some of the things that we pass out, that we send out to you.
Any other questions?
Sorry, go ahead. Whoever said that. Was that
I do. I have a question. In my stand, it's not your typical concession stand. Do I need to sanitize in between every single customer, the counter?
No, I don't think so. No, you don't. You know, I mean, again, your workers are gonna need good hand hygiene, all the practices that are typical.
Do all of them need to wear masks? I have plexiglass in between us.
Masks are optional. Masks are a good idea if distancing is not possible.
Because
Okay.
I have a metal cage and plexiglass in between them.
Yeah. Yeah. Mask. You know, you might have. I mean, we've had it all over the board with the public. Some people are maskers and they believe it and they want to use them. And other
So
people
I can make it a suggestion, but not mandatory.
I would make it voluntary. I mean,
What about my umpires?
Yeah. So you know, we actually just.
My umpires don't stand right behind my catchers. You know, they're not right next to them.
I mean, and again, this is, you know, we just had this conversation last night about umpires. I mean, realistically, is it, what did I remember what I said? Less than 6 feet for more than 15 minutes. Umpires are sitting behind, 6 inches behind a catcher for an hour and a half. You know, that's not ideal. I mean, that's not ideal. And I know that, there might be ways to kind of work that. I mean, I know I would recommend trying to find ways to avoid that close of contact for that length of time.
Well, because I'm the slow pitcher. My umpires don't stand right on top of the catchers. Actually, they don't even stand next to each other.
The umpire
we went to mat ball this year too, so they're going to be even farther away.
Yeah. So, I mean, again, I would say that masks are optional. Masks are voluntary. I mean, that would be a lot to ask an umpire who's got gear on and stuff like that to be throwing a mask on top of that too. You might, we're in the dead of summer. I mean, you might be creating more problems than, by doing that. So
okay.
I would spend more time trying to figure out ways to distance than I would putting masks on everybody.
Okay.
Distancing is more important than the mask wearing. The mask is for when you can't distance.
Perfect. Okay. Thank you.
Hey, Tyler, Mike Malinowski.
Yeah. Hey,
got a question. Is if we find some spray sanitizer that comes in a bulk, can we put that in a sprayer and after the game, each game, like spray down the bleacher, spray down the dugouts and racks?
So.
Would that work?
Yeah, I think so. I mean, I've seen some of these things out there, kind of these mister type things that people are selling. I mean, the thing is, if you're going to do it, you want it to actually get on the bench, so if you're actually spraying something and it's windy, is it getting on there? You want to make sure that it actually gets on there. And it might be something where, I don't know that necessarily, again, I've seen some of these misting products out there where they're just got their wand and they're spraying it all over the place. I don't know that that's necessarily a replacement for, actually kind of physically wiping something down. I think those would more be situations that are maybe hard to wipe down. So, I'd still probably, actually wipe something down. But sure, a spray of some type by all means. And then, I'd probably just get somebody out there and just to make sure that it actually made contact with that surface. Because again, if you're spraying stuff in the wind, it blows all over heck and you might not get it where you want to.
Okay.
Tyler, I have a question about contact tracing. For us at the pools, for example, it's going to be a lot easier because everyone comes through one entrance. It's really easy. We're gonna have some sort of a sign-in sheet that you would put, Tyler Brock in at, May, June 2nd, this time. And that way, if we get a confirmed positive, it's pretty easy to reach out to you guys. Would you recommend anything for, everyone here has a different facility that's, hard to control an entrance point. What would you recommend? Because you talked about this earlier, but is there a strategy for doing this in case we do get a positive?
It is a little bit harder at the parks, where you just got parking lots and you don't just have entry points and things like that in a lot of our places. Yeah, I probably wouldn't, it's going to be next to impossible, I think, for most of the places to kind of monitor who's coming in and who's coming out. I think we just need to try to focus on more of the macro level kind of things that individuals try to space out rather than try to bite off too much, I guess, in that. But yeah, it sounds like you could probably do it a little bit easier as people are coming into the pool one by one. I don't know, might be a little tougher to do in the other places.
Tyler, this is Jessica. I just wanted to say that I appreciate all your guys' help because I think that we are totally going to be looked at as far as how we're doing things. Are we doing them right? And if we can help utilize each other and our resources, I think is going to be very beneficial for everybody moving forward. You know, I've imposed that upon my coaches as far as we want kids back to school. So let's help educate them on what to do, you know, and
and it's gonna matter for, it's gonna matter for fall sports, and things like that. It's gonna, it's all gonna kind of dovetail in, and things are, and let's not forget, I mean, things are looking better in Woodbury County. There's no doubt in my mind. I mean, things are looking better, but they're still not wonderful. I mean, we still have, COVID-19 in the community. there is no question about that. So, I mean, we do still have infections here. We have a lot of sick people in the hospitals yet. And, so it's not gone. And we need to be able to, be grateful and be thankful that we are where we are now, that things are better, and that, hey, we're in a position where we can actually get some ball played, this summer. But we can't be ignorant to the fact that we do still have COVID-19 around, and will probably for the foreseeable future. So we got to take it seriously. And so again, what we do, and I say we, because I'm one of you guys too, what we do makes a big difference for a lot of things moving forward.
Question 2, with my adult program, when we have our tournaments, out of town teams, what is your advice on that? Should we just not do it? Not let them come in from out of town, or what is your advice there?
The out of town doesn't bother me. I mean, it doesn't bother me from out of town. I mean, frankly, we have more in Sioux City than anywhere does,
Okay.
So I mean,
it'd be talking Omaha, Sioux Falls usually.
I was going to say, they probably would be like, yeah, I don't think I'm going to let Sioux City people come here.
Exactly.
Okay.
I was just curious.
No, I'm not worried about out of town. I'm worried about the crowds.
Yep.
I'm just the.
Well,
the
I think we're going to put a cap on teams. Some of our tournaments are.
The amount of people you bring in is more important than where they're coming from. If that makes sense.
Because some of our tournaments can range from 35 to 40 teams. I think we're going to cap them out like at 24.
Yeah.
That would be about half capacity of what we normally would do.
Yeah. Yeah,
Okay.
I think that's reality for all of us. We got to try to find a way to reduce that kind of thing. But as far as where they're coming from, that doesn't bother me.
Okay, super. Thank you.
Tyler, Mike Malinowski again.
Yeah.
A question: if we find irate parents that don't want to go by these rules, my opinion is we ask them to leave. If they don't want to leave, the whole team will leave, because we cannot have the media get a hold of this stuff. You know what?
Right.
It jeopardizes the whole league. It does. It jeopardizes the whole league. And, not everything that we do, in other years that individuals do jeopardize the whole league. But this year, it kind of does. So I think that's really the long and short of it. And, I mean, frankly, we're kind of lucky to be playing it all, I think. And, that's, this year especially, things that individual people do jeopardize the whole league.
Yep, I agree.
Mike, the city's here to support you as well. Sorry, Kevin, I'll let you go in a second here. The city's here to support you as well, and in that endeavor, like Tyler said, we're here to back you up for it. I think we're going to get 99.8% voluntary compliance with this stuff, and people are going to be willing to get back out there. But obviously, us and Siouxland District Health are here as a resource to help with that. I mean, hopefully, it never gets to the point where we have to call a non-emergency police number or something because somebody's so irate. But
Right.
we're here to help out with that, and like you guys said, for us to continue and for the future of sports and gatherings, we're here to back you up, and that one person here and there, we're here to help out with that.
But it will happen, I'll guarantee you.
Yeah.
All right, Kevin Egard here, and I don't have much to say because Miracle League is completely different, but I'd echo Jessica. Thank you to Kevin and Tyler and John for getting us together. The one concern I'd have is, with everybody so worried about, someone videoing people not close together or too close together or that type of thing. John, have you thought about making rules for all of us that we have to follow? Because my concern is, there's grandparents who have grandkids playing in different leagues. And if I go to Headed and it's one experience and I go to, Morningside and it's a different one, are we creating a greater opportunity for people to go, what the heck's going on, and be upset?
Yeah, we did put a lot of thought into that. And I love the idea of a universal approach. I know that just by talking to and getting to know a lot of you, through phone calls over the last month or so, but everyone's facility requires different things. And just Rita, for example, with the adult leagues is different than the way, some of us are going to do T-ball and Jessica's going to have the middle school, we all are in kind of different situations, which makes it a little tough. The point of getting this call together and getting this guidance out and asking for everyone's, protocols on how they're going to run their leagues is to look it over and say, like, okay, we're on the right path here. We're heading down, we're going the right direction. So as far as a universal rule across the board, at this time, I guess we weren't going to require anything like that unless Tyler or Kevin, thought that might be something that would be more effective for us.
It probably, there's some merit to it. I just know how hard it is, because everybody's a little bit different and that kind of thing. And our facilities are different, and it's tough. It would be really nice, but it is tough.
And I would just add, John, I would, your expectation of 98% compliance, I think it's going to be just the opposite. A week ago, we had and this is just from experience, we had a celebration of life at Sunnybrook, 120 people. We met them on the outside, said, and it's just natural instinct for people to gather. And you go and break them up and say, listen, we got a social distance. And all they do is move 6 feet away as a beehive. They all go together. So I think Mike's question is really a good one, and that's what we're going to face. What do we do with parents and parents that just continue not to do the social distancing?
Yeah, I think I'll kind of go first here, and then if someone from Siouxland District Health wants to hop in with their thoughts. But boy, I guess you make a good point there, Kevin, because we put out studies for how people feel on this, and I've read other directors' reports from around the state, and it's funny how split people are, and then with how they feel about the virus in general, right? You can 50% of people are going to be mad at us for opening, and 50% are going to be mad if we didn't open, right? And that's just at the baseline. And and then you go further and there's more I get that anger. So it's going to be a tough road here, especially for you guys. I don't envy a lot of the positions that you're going to be in, because I know that volunteerism is hard, and it's hard to get people out at your facilities to help coach people on where they're supposed to be and stuff. So this is going to be tough for us at, with the city and having like the pools and stuff like that. It's going to be easier for us just because I have a lot of staff that are right there and can move people around. And gosh, I'll turn it over. And Tyler, you've been around the sport and stuff. How do you see this being feasible?
I'll be honest with you. It's hard. Like I said, we were having conversations last night, and to be able to kind of pull off the kind of things that we need to be able to do, it's not going to be easy. I wouldn't have I don't blame anybody who says, you know what, I'm not as worried about the virus as I am trying to figure out how we're going to do this logistically, how we're going to actually do this with all the things that we have to put in place, and how are we going to do that? That's just a tall order for my volunteer organization, or even my organization that's got some staff. It's still a tall order. There's no underscoring that. And yeah, so this is not an easy thing to do this summer. And it's relatively short notice, right? We didn't know that we could even do anything until a day or two ago. And so, you know, now you still want to try to get something in before the summer's over. And so, yeah, it just, you know, it's not easy. It really isn't.
John, one more thing from Mike Malinowski. You'll back us on that decision though, if we find some parent that won't do this. So if they won't leave, we send the team home, we send the other team home. You'll back us on that because they're not following the guidelines.
Yeah, look, you know, we sent out a document for all you guys to sign saying you're going to do something, you know, and this goes back to what Tyler's been talking about with the image of, you know, you're an extension of us in a way with the, you know, being a city facility and everything like that. So yeah, you know, we're here to help out. If one person and one team is going to ruin it for everyone, you know, we're here to help and say, look, this is, you know, this is your little league, that, you know, that you're running this, city's behind you on it, you know, you signed a document, and that's what we want to, you know, come in and help you out and be that force. If that's what, you know, what it's going to take. Gosh, I just hope it doesn't come down to something being, you know, that serious to the point where it's that tough. I'm really hoping what you guys get is a lot of help from your parents, and you know, I just don't know. I know, you know, Kevin, to your point, with all the stuff that's been going on over the last couple of days, it's like, you know, you kind of forget about COVID almost. You know, there's just been so much in the news and it's been overloaded. You know, and I find myself too every now and then kind of talking to people really close and not distancing when I'm at work or just at meetings. And it's going to be tough to get people to break, you know, those habits. And I think all of this, just even this conversation that we've had and listening to Tyler, you know, go over this PowerPoint, I'm just rethinking, okay, gosh, I need to reiterate how serious this is again, because we had this big wave and it was beat down into our heads on, you know, social distance and wear the mask and do all these things. And then, you know, over the last week or so, I've already, you know, started to cut corners here and there. So, man, I think we're going to have to take a lot on as people that are running leagues. And let's just hope that I think we can get some help from parents, because otherwise I think we have a tall task ahead of us.
John, I don't know if you're interested. Every Friday at 2 o'clock, we do it through the emergency management. We do a press conference related to updates. There may be a potential that on this Friday, I don't know what else I have, but either you or Matt or somebody from the city, because I think one of the things that's important is probably for the general public to see, here's what you've challenged all the leagues to come up with, a plan, sign off an agreement, here's what our expectations are, and just really to begin to drive some people the understanding of this is at the city's initiative, the leagues are trying to comply with it. So it's not necessarily, you know, they have some choice and flexibility, but it's what the expectations we placed upon them are. And so it may help more of those people begin to understand this is more than just, you know, the Malinowskis there at Morningside Little League doing this. It's the fact that the city has this for the safety of the kids. And I think that might be some things that might at least some awareness created.
Yeah, I love that. And I'll get with you after this. And if that's something that, you know, Matt might want to hop on that as well. But yeah, I like I said, anything we can do to come out and say, like, you know, look, this is our expectation we're passing down onto them. You know, we're the ones making these, you know, little leagues with these, use us as the bad guy, right? You know, John's going to come down and yell at you, sort of thing. But, you know, we're happy to be that force to help out with this. Is if it's between, you know, if it's between not having a ball season at all this summer and pissing off a parent here and there, you know, we're happy to take the safety of the greater community here and get to play some baseball just in a different sense than it's looked like in the past.
But John, for you just to get on there and state that you will back the leagues and you will back, you know, ask people to try to do their part and follow the rules. That might help too. More people that hear that, the more people that are going to go by those guidelines.
We are actually looking at doing a lot of signage, more not at the building facilities, but kind of spread out around the park. Even if it's banners to go on the fences, to the tune of listing some of the rules, and more of, if you want your kids to play, you have to obey the rules. So kind of just more education stuff for the people, as opposed to us trying to run around and shove it down their throats.
Right.
Yeah, I completely agree. The signage is going to be huge. The education piece is going to be huge. And if we can hit it and pound this into people's heads early, you know, you're going to help the rest of your summer. You know, if we're lax on it early, it's going to be tough for people to get a hold of it. I know Jessica with SYA, she's got something she's making people sign. Do you want to talk about what that is, Jessica?
Well, I created this document, and basically it was a waiver off of the waiver of the cities. And I'll be honest, I sent it out to all my coaches, and the verbiage, some people were not happy with. And so I've sent it back to John and Matt to make sure that the verbiage is okay, because I'm not a lawyer. That's not my thing. And so, but again, wanting to protect everybody, you know, so I have them, they're going to sign it by a team, and everybody has to sign it because, you know, they're playing under the assumption of COVID is here. It's, you know, this is just the gift that we're even playing, but you are playing with this in the area. And so I'm trying to get that in place. We start practices tomorrow. So I have 6 fields that are scheduled to practice. So I'm going to be probably a guinea pig, and I'm going to be out there trying to help and put all these things in place. But we've had a lot of good feedback, and we've had some kickbacks. We'll have to just kind of wait and see how it goes. But those waivers will have to be signed before they can play on the 15th.
And that's obviously, you know, for whatever reason, also helpful from a legal standpoint. And more importantly, I think it's the, like, hey, look, you're as a team, you sign this, you know, waiver that says you're going to abide by these best practices, you know, to keep our community safe and the other players and coaches safe. And, you know, if they don't now, and if you're having an issue with it, that's an easy one to fall back on as well. But.
Hey, any other questions or comments? Then we've taken an hour of your time for tonight, but we appreciate it. And I've sent the document to John. He'll get that sent out to all of you and make it aware, and then put it on the city website. Doesn't matter is what it was for sharing that. And then the recorded video. If there's anybody else that you know of that asks questions, what they cover, direct them to watch that is what it would be, and give them a chance. And like I said, we're interested as questions and issues come up. We had our first coach call today, not against the youth, but high school. Had an individual go to the doctor, thought it was strep, came back negative. They did the COVID test. What's the first thing the teenager does? Goes to high school ball practice. Coach immediately sent him home, got him out of there, that type of stuff. So they are also battling at that level, but we're sending the same document to them because hopefully they're doing some consistent messaging then and understanding guidelines and education with those high school parents and that too. So, you know, never will be ideal, but the more information, the more we can get out there, I think the better we'll be.
Good luck to everybody. Stay safe.
You bet. Thank you.
Thank you.
Thanks,
Thanks,
guys. We'll
guys.
be in touch.
Thanks,
Thank you.
guys.